Welcome to the Possibility Action Network podcast. I'm your host, Stephen Middleton, aka Possibility Man. We are committed to bringing you guests who strive to better people's lives and serve as a force for good in the world. Our guest today is Dr. Jonas Nguh. He is the Executive Dean for the School of Health Professions at the University of Providence in Montana. He holds a Bachelor of Science degree in nursing, a Master of Science degree in nursing, a Master of Science degree in public and healthcare administration, and a doctorate, a PhD in public health. He's a fellow with the American College of Healthcare Executives, and he works with the World Health Organizations to improve healthcare around the world. Dr. Nguh, you've been a busy man. Welcome to the show today.
Thank you, Stephen. It's my pleasure. Thank you for having me.
Well, look, I have a ton of questions to ask you, but first, this program note to our listeners and our viewers. Your support matters and is appreciated. Follow us, like us, and share us wherever you watch or listen to this podcast show. Our sponsor information is below the description wherever you find this podcast. Now, Dr. Nguh, look, I'm looking forward to getting to know you, and my listeners and viewers want to get to know you as well. Tell me about growing up. Where did you grow up?
Well, I was born and raised in a little small town called Limbe in Cameroon. That's in West Africa. I am six of seven kids. All my family is here. Thankfully, I'm here. We moved to the US when I was probably in my early or late teenage years. And I've lived in the US ever since then with the rest of my siblings and my parents.
I know that it was a long time ago, but what was it like growing up in the Cameroon?
Well, I loved it. There's a lot of poverty. People are struggling, but I come from a home where my father owned his own business. My mother was a stay-at-home work, and from a very young age, they instilled in us the principles of hard work so that you can better yourself and your family.
Mm-hmm. Now, Cameroon is one of these French-speaking countries. Do you still speak French?
No, I don't. We actually do speak both French and English since we're colonized both by the French and the British. So depending on where you were born or raised, you speak that language, and when you go to school, you learn the other one. I grew up on the English side. So we spoke English as a day-to-day, and in the school system, then you learn the other one. And the same thing with people on the French side.
I see. Okay. Now, you've done a lot of studies into nursing, as I've said in this introduction. I wanted to read each of those degrees because I wanted people to know how credentialed you are in nursing. What attracted you to nursing? At what point in your life did you say, I want to get into healthcare and I want to become a nurse?
Well, growing up in Africa, as you may or may not know, the girl child is disenfranchised from education. And women suffer a lot of, due to the lack of access to healthcare, due to the lack of access to available healthcare workers and all that. Women are particularly disenfranchised. And from a very young age, I witnessed many family members who, because of lack of healthcare or the resources, suffer negative outcomes. So from a very young age, I knew that one day I was going to, probably around age 5, I did not know, I knew I was going to learn something so I could come back to make a change or make an improvement. And that's where even at that young age, my knowledge about healthcare began to develop, so that when I had the chance to come to the US or further my education, it sort of just was a natural process to me.
Uh-huh. So you have had this feeling of being a difference maker since you were a child.
Yes,
Wow.
sir.
Where do you think that came from, though? What would that?
I think from my parents. I think the values that my parents instilled in us. My father was the one where, like the story of the Good Samaritan, when if he sees someone struggling or needed some help, he's going to stop everything he was doing to see if he can help you. And, I just grew up with those principles and that kind of philosophy.
Uh-huh. I see. Yeah. And once you got into nursing, you just kept going. I would think, and I don't know the statistics on this, but I would think that a lot of people would stop at the RN, the registered nurse, but you kept going. And not only that, you kept going, you're now board certified. In fact, you're the first board certified nurse executive I've ever met. Why did you keep going? Why
at the RN level, the change you make is only at the bedside, right? Typically, nurses at that level, you work with patients, providing direct patient care. I wanted to make a bigger, or at least where change happens, it's people that do research, people that do healthcare policy, all those big things, because those is where regulations, standards, all those things are developed so that those nurses at the front bedside, they have to work within those guidelines. So being at the top, at the decision-making table, you have a much more influential role than just being at the bedside.
Oh, I see. Yeah, and now as a nurse and as an executive, you have worked, if my count was right, in over 20 countries around the world.
Yes.
You're also associated with the World Health Organization. What is, I think you are better to answer this question for me than anyone else I could imagine. What is the status of healthcare today around the world, especially in underdeveloped countries?
Yeah, well, as you can see from the pandemic, it exposed a lot of gaps within the healthcare industry right here in the US. But generally, universally, there's a shortage of workforce. I mean, every single way you go, there is not enough nurses to take care of the whole population. So, and that's one of the crises that the US is now facing. But specifically in low resource settings, people don't have the money to, first of all, go to school. And even when they get out of school, they just can't find enough jobs. Because, for example, in my country, there's very few private institutions. So most of the hospitals are owned by the government, and the government doesn't put the required infrastructure, so that people can get back into work or at least impact the healthcare system. Then there is lack of facilities anyway, too. You could travel maybe 200-300 miles to find the nearest healthcare setting. And that's one of the things where a lot of people are marginalized, where let's say if you had a heart attack or, you're in labor, you're having contractions, with the nearest hospital being 200-300 miles, you have no access to transportation. What are you going to do? Or even there's a shortage in healthcare workers. And then here, specifically in the US, a lot of the nurses are aging, right? And the young people do not want to come into the system because it just doesn't pay. In order to teach, you need a terminal degree just so you could come and teach. So many of the schools, first of all, don't have enough faculty to teach, and young people are not attracted to come into it. Then this pandemic just came and blew out everything, where now a whole lot of nurses are quitting because of the demands of the nursing. By itself is a very demanding profession where you are on your feet, the entire time. So it just exposed many of the weaknesses that were already there, both in the US and universal.
Yeah. From what you just said, I see two problems here. One is you said, there's a shortage because young people aren't getting into nursing. But secondly, it seems to me then, as nurses retire or quit, we're losing some of the most experienced healthcare.
Yes.
And then we don't have a lot of replacements. So,
yeah. Exactly. And that's the thing where that knowledge that used to be passed on, let's say in your local hospital, you have a nurse who had 20 years experience. That knowledge, when they retire, they take it with them. They can't train the new people coming in. If for one, there's not enough coming in, but those that decide to come in, they've just lost out on this nurse, because it's one thing to study in the book and have that book knowledge. It's a whole other thing to have done it. And you now understand where you have faced different kinds of situations and you know what to do. So those new nurses that come in are losing out on the wealth of experience that the older nurses have to pass on.
Yeah. Would you say that the same applies to medical doctors? That is, that as doctors age and retire, that the young ones coming up are fewer and fewer. We're losing a lot of the most experienced people without adequate replacement.
Yes, and that's true. But add to that, right here in the US, one of the greatest challenges is that there's not enough primary care physicians. We just don't have them. Because when they do go to school, many of them choose to work in a specialty area. And you know, with a specialist doctor, let's say cardiology or endocrinologist, you only see them if you have something pertaining to that system or that condition. So there's not enough of primary healthcare physicians. Registered nurses or advanced practice nurses, what they call nurse practitioners, are helping to fill that gap. And that's how the NP specialty developed. But now the challenge too is that in several states, not all, the NP profession, you have to have a physician supervise you, your work. Many states, I think, for example, in Maryland, are now doing away with that regulation. So just to ease up, so that there are many more providers. But that's one of the greatest challenges where, specifically in the US, we just do not have enough primary healthcare physicians. Because those, if you've gone to medical school for 7 years, you want to go for a specialty area where you can make quick bucks, big bucks, you can pay off your house, pay off your student loans, which is humongous, sometimes 300 to 400 or even 500,000. That thing follows you the rest of your life. So you wouldn't want primary care where they get paid lower rates than a specialty. So the problem just begins being compounded.
Right, I see. Do you think the pandemic, COVID-19, will slow the readiness of students going forward? Let's pick from, let's say, 9th grade in the USA, just to slow their readiness to get into a challenging program like medicine going forward?
Actually, we're hoping that the reverse would be true, because it just exposed the need of, it exposed that we have a shortage in workforce. And right now there's conversations at different levels to see what can we do to sort of incentivize people to come back in. Maybe it's a student loan forgiveness program like the federal government has, or some kind of incentive, salaries and all that, where institutions are willing to pay, or, just so people get much more interested, because otherwise the gap is just going to get wider and wider. So there's actually conversations right now. One of the things which is slowing down is that when the pandemic hit, there was this whole big thing of travel nurses, where sometimes nurses were making somewhere between $6,000 to $10,000 a week, and you get a lot of people. But as COVID is dying down now, those rates have gone down. We are getting back to where we used to be and still experiencing the same challenges.
Yeah. I could see a case whereby cities may want to sponsor the medical education of students and have those students come back to their cities to serve that population. Yeah. Okay, but look, I met you on LinkedIn, and what drew me to you was that you share a message about scars. And I want you to, generally, what is that about? What's that message that you're sharing?
So if you know, or those who do not know, I just came back from a open heart surgery, and this is the third one that I've had. Having gone through all of that, obviously with any surgical procedure, you're going to have scars. And for a long time, I suffered from this syndrome where I wouldn't want to look at those scars, even when I was, taking care of grooming myself. But after this third one, and with the situations that I went through that led to this third one, it made me change my mind as to how I view those scars. So for anyone who's had a scar, or you have a scar, whether it could be physical or emotional, having that scar is a sign that you've gone through the battle, you've come out on the other side stronger. You have something, and somebody said, I can't know who it is, that scars are a sign of grace in our lives. God has taken that scar and turned it into something beautiful. It is something to remind you that you've gone through the fire. you've gone through the ringer, and you came out strong. You're still here. You're still moving on. So when I look at those scars, the ones that I have nowadays, I'm just so thankful for the grace that God has shared on my life, because not everybody makes it out. Some people go through a whole lot and are not successful. So when I look at it now, rather than be reminded of the pain, the trauma, all that I went through, I now just feel so grateful that I've been through all of that and I'm still here standing, only because of the grace of God. So it actually changed my mind. And that's why I decided to put in that message with the picture so that people can actually see what it is. And also it just keeps me humbled every single day.
Yeah. So, and that's 3 very serious surgeries. Yes. How did that affect if it did at all, your mental state as you were presented, for the 3rd time, the need to?
Yes. I was very anxious or nervous, anxious, just because having gone through it 2 previous times, I knew what was coming, right? I knew the pain, the medications I'm going to be on, the rehabilitation process, very, very painful. I spent many nights sleepless, being on pain medication. So I knew what was coming and I was not looking forward. Now, the surgery itself, I really had no problem because you're asleep, but by the time they knock you out, then you get up, it's already done. It was a recovery process that takes so long. You feel so handicapped. I had people bathe me. I couldn't even take care of my own ADLs. You are that incapacitated. So knowing that I needed another one, that was my greatest concern. Just that I have to go through this thing one more time again, and what was ahead for me. So very anxious. I just was anxious and nervous about going through it again.
Yeah, you posted on LinkedIn that when you see some people on social media, they're always many of us, I'm going to change that, are presenting our best posture. But you said people go through things. Tell me about that. What is it that you wanted to be
in
vulnerable?
This social media age, where people use filters, people go to all these luxury exotic places, and you want to present this image that all is well and good, and for the most part, not everybody, it is not always true. We do have ups and downs in life. We have challenges. And you might see somebody from afar, admiring them. Oh, they have a perfect life. I wish I was like them. A big house, a big car. You do not know what, darkness, or they are chasing, what they're suffering with. So for me, I wanted just to be open and vulnerable that, hey, you see me, this is who I am. I put my pants on 1 feet at a time, just like everybody else. I am no different. But even with the stage where I am, with what I've been able to accomplish, I still do have this thing that is a weakness. In the Bible talks about the Apostle Paul, who had some weakness, and he prayed to God for God to take that away. And God said no. He still did God's work, even with that weakness. So the whole idea here is just that don't think that just because you see someone strong doing this, everything is perfect. No, we all have our own weaknesses or challenges that you deal with. But you don't get that on social media. All you get is all the glamour and all this, And for some people, not everybody, that is not always the case. So I just wanted to let people know I too have fallen. I too have failed. I've been fired from jobs. I've been rejected many times. I too go home and I worry about paying my bills and all that. So this idea that everything is, all Pollyanna, sweet all the time. No, it is not. As a human being, we're going to have those dark days. We're going to have those weak moments. Even in the Bible, when he was carrying the cross, our Lord Jesus fell under the weight of that cross. So it tells us that we don't have to be perfect 100% of the time, and that's where the humanity comes in. Because when we are weak, it allows God to step in and then become strong. And so even with my last surgery, in my weakness, in my moment where I was incapacitated, God's grace came and just sailed me through. And so that was the message I was trying to send across.
Yeah, I see. Yeah, and you've mentioned two scars just in what you shared a moment ago. The physical scar, of course, with the surgeries and what went into that. But you've also said that you were once fired from a job. What was that like for you? Can you talk?
Oh, I've been fired from job many, many, many times. I don't think if you've been I'm in my mid to late 40s now. If you've lived long enough, sometime you have, whether fairly or unfairly, you did something wrong, your fault, not your fault. We have those moments where you get fired, you get let go, and all of that. So it's happened to me many times. And when it does happen, yes, it's challenging, it's difficult. But because I've just grown to be very what's the word? Tenacious, or what the way I've just grown to be strong. And because I know, and I've gone through it several times, I know God is always going to provide. God will have something better, something different. So when it happens to me now, I don't worry. Not that I shouldn't worry. I just move on to the next one, or I learn from that. I figure out what I have to do the next time and I move on. But in this life, we're going to have those ups and downs. I think it is just normal. It would be wrong for me to sit and say that everything is just going to be smooth sailing 100%. No, we're going to have those moments where we fail. And that's part of life. We learn from that, we grow from that. So I accept, if we're going to accept the good, we have to accept the bad too.
Yeah, okay. Now, in reviewing your profile, I came across, let me change that. I got the impression that you are a difference maker in the world, that you are a little more than someone who has a job and you make good money and you go home, that you're trying to. So tell me about some of the projects that you've been engaged in other parts of the world, especially
Yes.
especially in Africa.
So my area, or at least one of the areas, going back again to my childhood and how I grew up, is in maternal infant health. We talked about the lack of infrastructure, lack of transportation, where people have to travel hundreds of miles to get to the nearest hospital. In Africa, probably a lot of women suffer from lack of access to healthcare, and they die during childbirth, or even when they give birth. In maternal infant care, they really don't have. Many of them go through the entire pregnancy without going to see a doctor. And coming from a family with many women within it, I had that firsthand experience of seeing how disenfranchised women are. So I wanted to use my knowledge and education to make an impact. And one of the things I did, or we did it several years ago, which gave me two of my 13 plus award, one from the American Public Health Association in 2019, and I think the other one from National League of Nursing in 2015, is that we designed a new model for maternal homes where women who do not have to go to a hospital, which probably hundreds of miles away, they could be cared for in those maternal homes. And then because women do a lot of hand crafting, handwork, they weave baskets, they sew, they knit, though they do farming. The money from those, they have livestock, can be used now to put back into those maternal homes, right? And it funds those homes. A nurse comes in maybe once a week, checks on them, and just so that it avoids them traveling hundreds of miles away. Now, this program has now been implemented, I think, in across 5 different countries, with evidence now indicating that over 2.5 million women have accessed services from those homes. So it is making an impact. It is making a difference. And it's sort of like breaks the mold or solves a gap, closes up a gap so that they can come to those homes, receive their care, get a safe delivery, and go back since they can't afford transportation, or the nearest hospital who could be hundreds of miles away and they can't get to it. So this is sort of like a bridge to close that gap. And I'm so glad that they did that because we're seeing the impact that it is making. So to make a change, you don't need to be there, right? You could just identify something, design something that once implemented can help them. And that's what we did.
Yeah, okay. So when you look at, I want to do a little more with the barriers to adequate health care. And let's start with the United States. And so when you look at the US itself, what are some of the barriers do you see for adequate health care in this country?
Yeah, as we talked about earlier, for one, there's that shortage of healthcare workers, specifically in nursing. Because nurses are frontline caregivers, right? That's where there's the most need. The population is growing. I think the U.S. population is now over more than 300 million people. It is growing. We have the baby boomer generation that is also growing. So many of the nursing homes, many of the hospitals, they just do not have enough frontline nurses to take care of the population. Then we have the model of healthcare is all profit-based, where many of these private hospitals are looking, how do we make more money for our shareholders? So they are cutting down on staffing, right? Then those nurses who are left are now forced now to work with heavy patient loads. And they're doing that for less money, because nurses do not even get paid enough as it is, even without the pandemic, for what they are doing. They are probably, as a profession or a discipline, they are probably one of the lowest paid. So when you begin to think of that, why should I go in for low pay, and then I have this humongous workload and working long hours on my feet? A lot of people would not want that. Their working conditions themselves, it's really stressful. And then nurses as a population, as a discipline, I don't know if you've heard about this. They said nurses eat their young. It is not a very welcoming for those who are new. So many nurses, and the research has stated this, within their first 2 years, they quit the profession. Wow. So if you've gone to school for all these years, you come in thinking that is all this glamour and rosy, you hit the floor, you identify all these challenges. Some people don't even stay. Within 2 years, they quit the profession. So the problem just keeps getting compounding, and it really hasn't been solved. I remember when I was in school, we were learning about the shortage of nurses. Till this very day, we're still talking about it. And it's just because the right key players have not come to the table to say, okay, what can we do to solve this? On the administrative or executive side, it's all about making money. How can we cut to the bare bones, right, to make more money? Look at during the pandemic here in the US, many of these hospitals did not even provide face masks to their staff, or they were being told to wash them and reuse them. Now they are the ones putting their lives at risk, while the big executives are making hundreds of thousands of money. Or in many hospitals, just as a thank you, they'll buy a pizza. Why? I mean, what does a pizza mean for someone who's putting their lives at risk? So many nurses just get burnt out, and they just quit the profession altogether. So it is a multifaceted problem, one that you need all the players to come and sit. But given how the industry is structured, it is only those people at the top who get to make those decisions. The nurses themselves are not involved. That's why they don't have any agency. They just go. So a lot of people can't deal with that.
So from your association or affiliation with the World Health Organization, what is that organization doing to improve health outcomes around the world?
Well, many recommendations have been put forward. I mean, this is not the first time they've said all this stuff. That knowledge is out there. It just comes to what the individual institutions want to do. Because they are not the WHO is not a regulatory body. While it is international, it is all voluntary. Member states could decide not to join, or even when they do join, they can also decide not to implement those recommendations. It's not like you get sanctioned. So they are putting many recommendations and all that, and a lot of conversations keep going on. But the implementation, it comes down to who is responsible. If I'm a shareholder, a company where all I care for is looking at my bottom line, I want to see what revenues we're generating. I'm not going to be worried about that. So the decision-making authority really is not in the hands of nurses. but we have those recommendations and those conversations and all this great body of literature that is available there. Because they are not a regulatory body, they really can't implement anything. It's now left to the individual member countries to take on those things to do.
Yeah. Okay. Now, from your chair as a nurse and of course a researcher and writer in this area, who is responsible for keeping us, and I would say us, I mean people throughout the world, healthy? How do you see that?
Well, you have for one, your either local or state health department, you have that, and they have their own role too. Things like clean drinking water, things like air quality outside, they regulate those things. Then you have your state regulatory agencies like the Board of Nursing for each state. You have that. You have CMS, Center Medicare, Medicaid. They also have their own standards and laws relating to how you do billing, what you should do so that you submit the right bills. So each of those agencies has their own standards for practice and what they require. It will just depend on what we're talking about, but it's a multifaceted role. Everybody has their own part. For example, the Board of Nursing ensures that all nurses are competent, they practice safely, all those kinds of things. They guide the practice of nursing. Then you have like your public health agency that will make sure that, okay, in this county, there's clean drinking water, right? That's a healthcare issue. Outdoor air quality, let's say there's some manufacturing this thing down the road. Where are they dumping their waste products? Don't go dump it and then contaminate the water sources. So the health department, or if there's a terrorist attack, your health department takes on to make sure that people are protected. And even things like disease outbreaks, there are certain conditions where if you have that, it's reported to the state. So the state can be monitoring to make sure that, maybe you heard about the monkeypox. We want to know, even if we have one case, there might be an outbreak. Let's start checking, so there are many of those conditions where if you present to the hospital is required to report it, just so for that surveillance and monitoring purposes. Then you have centers for Medicare, Medicaid that also govern. Somebody had a congestive heart failure. If they come back to the hospital within 30 days, I will dock you the hospital. So that hospital now has to ensure that before we discharge this patient, let me make sure there's continuity of care. Let me make sure they have a physician to follow up with on the outside. So otherwise, if they don't, CMS is going to come back and dock you and cut some money from a payment. So all these agencies work in tangent, but monitoring their own area to make sure that there's adequate or satisfactory healthcare for the population.
Yeah. So you're saying a responsive government is essential to having a good healthcare system.
Oh, definitely.
So an underdeveloped country, I mean, I'm not going to name any countries here, but people who live in an underdeveloped country may have a difficult time because the government may not be as committed to ensuring clean drinking water.
And in many of those countries, for once, in government institutions, they really don't have those what we call standards of practice. They just don't have that. I know because just in a couple years ago, I helped develop the one for the country of Kenya, where they had their first standards of practice. So in many of these countries, those things do not exist. Or even when they exist, nobody's implementing it, right? Then you have private hospitals where wealthy individuals have opened them, whether it's a clinic or it's a facility. When you go to those ones, nobody governs them. All they are interested in is to make their money. So just because there's a lack of infrastructure and the government doesn't invest the money to build the system, unscrupulous individuals who just come in, open up a clinic or a healthcare center, charge people whatever they want to charge. And because the population do not have a choice, they don't have any voice. You go there just because you need that help. So there's a whole, you build the house from the foundation. You don't start building it from the room. But because there is no foundation that has been laid, you'll just have a little patchwork kind of healthcare. That's what you have there, where people are just trying to go to wherever they can go, but there is no system in place.
Yeah, we have some challenges ahead. There's no doubt about that. So when you look at healthcare around the world, there's some countries that have, like government-sponsored healthcare, and there are other countries that allow companies to run as independent businesses. Where do you stand? Which do you favor?
I think you need a mixture of both. You can have, if you look at countries where, for example, in the US is a capitalist market, right? In the UK, it's all government sponsored. Now, there's advantage and disadvantages to both of them. Here in the US, because it's capitalist, if you have your money, you can pay for it, you get it done. But in the UK, because everything comes from the government, now they're having a long waiting list because you can't get any surgery since you have to wait, So with every one of them, you're going to have advantages and disadvantages. But for me, I think you need a mixture of both so that there's enough, because the challenges in healthcare, not one organization or agency can solve it. If remember, the population is growing. While all this are happening, people are still having birth, still giving birth, and the population is growing. So who is going to take care of all this population if you do not have both government and private this thing? I think the key is having those framework as to how we go about it. Because if you only just want one, then you're going to have the disadvantages of that one. But if you have both two, people can choose, and you have more providers that can actually adequately care for the large number of the population.
Mm-hmm. Yeah. So when you look at healthcare, is there such a thing as personal responsibility in maintaining adequate health or maintaining your personal health?
Yeah, I think there is. I'll answer this question like one I was telling one of my friends, where we're talking about dieting, exercising, not drinking alcohol, not smoking tobacco, all those kinds of things. And he told me that, well, everybody's going to die of something. I said, yeah, that's true. But it doesn't mean that I should go on or into the middle of the road for a car to hit me down. So yeah, we're all going to die from something, but don't be the cause of your own death, right? Try to do those things that enhance your health, that keep you healthy and helps to longing your days. Don't just go stand in the middle of the road that a car should knock you down. I mean, everybody's going to go, but we do not want to be the cause. So things like making sure we exercise regularly. If you have high blood pressure, you're checking it at home, you're taking your meds, you're drinking enough water. Those are those healthy habits that we just do day to day. But even to going beyond that, make sure you have a primary healthcare physician. You go see them at least once a year. Get all your screenings done. There are certain things that we should also do that will help to push our own health. Now, it doesn't mean that everything is on you. We also want a government too that will provide enough hospitals, that will train doctors and nurses so that they can care for the population. So I see an argument to be made on both sides that we want the system, we want the institutions and the facilities and the resources, but we should also be responsible for our health. Now, I might have high blood pressure, and if I'm not taking my medication, no matter if there's 100 nurses or 100 hospitals, if I'm not taking it, or I'm drinking 5 to 6 bottles of alcohol per day, I'm just putting my own health at risk. So there are certain things that we too also have to take charge of. And that's why working hand in hand with your primary healthcare physician, whatever your own situation or condition is, they can say, okay, I want you to maybe exercise 3 times a week, maybe cut down on the alcohol that you drink, so there's an argument to be made for both. We do need both.
Yeah, I think that's a fair answer. There's a public policy side, no doubt. You made that case because a private citizen can ensure, that we have clean water or, dealing with disease. But at the same time, what you're saying is that if there's some things that you can do, do those things that are within your grasp.
Definitely.
I think that's fair, Dr. Nguh. I think that's fair. Look, I saw that you had participated on you probably have done a lot of panel discussions. But
Yes,
one
I
of the
have.
participants, yeah, one of the participants posted something from a panel discussion that you were on. I don't recall the exact one, but let me tell you what she said. She said that she learned about building trust. So here's my question. Is trust important in the healthcare industry? Trust that is patient, doctor, patient, nurse. And also is trust important in the relationships between practitioners, nurses, doctors, administrators? Do you get anything
Oh,
from
yeah.
that?
Oh, yes. Oh, yeah. In fact, that's one of the first things we learn in nursing school. When you go to nursing school, your first course that you learn is fundamentals of nursing.
Mm,
And the first thing they tell you is how to establish that trust between patient and nurse or patient and physician. Because if I'm a patient and I do not trust you, then I'm not going to listen to anything you're saying, no matter whether it's from God coming down from heaven. I'm not going to listen to it. You've just spoiled that trust. So the first thing we learn to do as nurses is how to establish, we call it in nursing, that rapport, and there's certain techniques or when what we are taught how to establish that. Because then it opens up the patient to tell you, let's say you met them in a hospital, in a clinic. What are you here today for? How can I help you? So the patient begins to open up. But if that trust has already been broken from your first interaction, I do not even want you, and I'm not even going to listen to what you have to say.
mm,
You've already just ruined that. Then, even between practitioners, nurse to doctor, nurse to another healthcare worker, and all that, in between, if they do not trust you, nobody wants to work with you. Now,
mm,
imagine you're a doctor, or I'm a doctor and you're a nurse. You're coming with me with information that I doubt is skeptical. Well, but where did you get this? Is that what the patient told you? Or maybe you faked certain pieces of information. That doctor would not want to work with you. They might probably want to get rid of you. Now, in nursing, and they've done many, many surveys, probably from the last 10 to 20 years, where the public has consistently voted nurses to be the number one profession in healthcare that they trust. And that says a whole lot because we as nurses, we are the front line. We're the ones interacting with the patient every single day, 24 hours a day. So you need to make sure that you have that trust so you can collect the necessary information. If I'm taking care of little Miss Jones in a nursing home and I saw that she hasn't eaten and then she has this medication that, they need to eat first, I'm going to, well, how? Tell me, why haven't you eaten? I need to know that reason so that I can tell the doctor. Or maybe they're having some side effects. But if I do not even trust you, I look at you, I'm going to make up something, or I'm not even want you. Then now you, the nurse, you just feel that patient because you cannot get the information that you need from them. Maybe they are having a runny stomach, whatever it is. Now you can't care for them because the patient can't trust you. It's same thing too with two different professionals. If you do not have that trust, nobody will want to work with you, and probably they might want to get rid of you
mm.
because I cannot trust the information that you're telling me about the patients that I have to care for. If you're coming with inaccurate information, then I have to adjust the patient's medication dosage based on the information you're giving me. But I don't trust that. Who would want to work with you? So that trust is so, so critical. And is the number one thing that we learn in nursing school, how to establish that trust. So that's why, as a healthcare professional, when I told you that this is what I assess, I give information, people just go with it because they know that you are someone they can trust. They don't question it. The problem comes if you've lied once or you told an untruth one time. It's very difficult for people become suspect with everything else because they say, oh, all this time, so you've been giving me false information, or you're a very fishy, sketchy kind of individual. Nobody will want to work with you.
Yeah, yeah. You were in this profession, as I said in the very beginning. Gosh, from the practitioner part to
Mhm.
professor to researcher, administrator, all of that. So, which of these hats do you like best? If,
Um,
if you can pick one.
yeah, I don't I really can't pick one. Each of them has their own unique features. But at the bedside, you're working directly with patients. following regulation. So, well, not regular. You have an order from a physician or other disciplines. Your job is to implement it. As a supervisor, on the supervisory side in a hospital, you are managing the staff, making sure that, okay, if I'm working the 3 to 11 shift, I have 4 nurses to cover. I'm making sure that we have a doctor on board. I'm just doing all those supervisory roles that my shift runs well, runs smoothly. If a patient has an issue, they're coming to me. Then in a management or executive level role, your job is to ensure that you have policies in place to cover whatever it is. It could be a fire drill. It could be a disaster. It could be a shortage of staff. You have those policies. Or if you're working in research, you're researching an issue to say, okay, how can we solve this? Maybe we need to go back and develop a new protocol to prevent infection. That is your own job. So at each level, or if you're a nurse executive, you're making sure that your budget stays on track. You're looking at the numbers. What supplies do I need for this month? How many nurses do I need to hire? So each of those has their own unique task and roles that you have to play. But I don't think I can pick one. I am by design an educator. I do that, and that's what I've been in the academic side for long. So I would like to say, just because that is my passion, I love that educational side where I'm teaching either nurses in a classroom or I'm working on curriculum to teach at a university, or I'm talking with faculty to bring in new faculty to come and teach, all those things that educators do. And I only pick that one just because that is an area that I'm passionate about. And I've been in the academic environment for 15 plus years. So I'll go with that one. But I think every discipline or every management level has their own good and bad. You just have to find something that fits with your personality. I love teaching. I love to talk. So I'll be biased against towards that one.
Yeah, follow your passion for sure. But you're also involved with serving, the profession in so many ways. If I got this right, you also work with males in the nursing profession.
Yes.
And how are we doing in there? Getting more male?
Right. As you know, nursing is a predominantly female profession. That's how it is. And we have more, I think right now, the last time I checked, we had probably anywhere from the literature states anywhere from 5 to 10% of men who are in the nursing profession. Now we're trying to, I had served on the board of the American Association of Men in Nursing, also on their board of directors a couple years ago. This organization, the goal is just to bring in more men into the profession. But we definitely need more men. We can, if we're going to solve the healthcare shortage and just address many of the issues that it's faced with, we can't just rely only on women. We need more men to come into and join. But now you have many programs in universities that are having incentives or having some kind of incentivization to attract more men to come into it. That's what association was geared to, just to put the word out, increase awareness for men to see that, well, nursing is a cool profession. I think as a society, we have been socialized to think that nursing is only for women. And so some men, oh, why would I go? It dehumanizes me for me to be a man, then I'll go into nursing. But there's so many specialties, so many things that you can do besides the bedside in nursing. But we definitely need more men. The numbers have been low for many, many years. We're doing a lot of work just to get more men in nursing, but more still needs to be done.
Yeah, I can just imagine that having more men in the nursing profession would actually improve the nursing profession. I'm not going to get into that part of it, but I can really see that. But you have been recognized by many institutions for your work in the healthcare profession. I think you've won well over 10 awards.
Yeah, the last time I checked it was probably 13 plus. I ended at 13 when I counted. So yes, sir.
Yeah, one that caught my eye, I want you to tell me about this one. The Social Impact Award from the British Council USA. What was that about?
Yeah, so social impact just means that someone who has the work that you're doing reflects or has made a significant and also a sustained contribution to improving the lives and conditions of people, right? So again, this was, I think this in that year I had about 3 awards, giving to me that year. But this is from the British Council, USA, the British ambassador who's to the US, who actually lives right here. They recognize me for that award, and they do it once a year where nominations are made. I think for this one, out of 1,600 nominations across 7 continents, I was selected. I was the one person, the finalist, and then I won that award for representing the US. For my work that I did with maternal infant health. And I'm so glad that it was actually recognized. But the award recognizes somebody who has made something significant, but also sustained. So most of the stuff that I do, right, as something that it will continue beyond what I've just done. One of the ways that charity or humanitarian work used to be done in the past is that, the person coming from the Western world, oh, we're just going to go into Africa and tell them what they need and decide that this is the solution. So now it has changed. Now it has flipped. With the new knowledge that we have, we look, okay, what do you guys really need? Let me come out and find out from you what your issue is and how I can help you. Rather than you coming from this Western world, like the savior, that savior mentality. Well, this is what you're going to do, and will wrap it down your neck. And when they did that in the past, for example, you're going to donate items. Let's say I give this one example, which will illustrate the point. You come to donate gloves for hand wash. Okay, you donated 300 boxes of gloves. Now they use them all up and you're gone. Okay, what do we do then? We go back to all the old ways of doing the things wrong, right? So that your charity work only made a small impact, but it wasn't sustained. And after you left, things go back to normal, right? So that you really didn't make any impact. Now, what we're doing is that we come and we find out from you, okay, how are you doing stuff? What resources do you have? Since you can't have gloves all the time, let me teach you how to disinfect this stuff so you can continue using them. So that even after I'm gone, now that you have a different way of doing stuff, you just keep doing that and that impact, it continues. Now I have taught you something you can do within your limited resources that fits into what you're already doing. So with this work that I did, like the maternal home I told you, since they didn't have, the nearest hospital was 400 miles away. So I don't have money to build a hospital, but what I can do is that I will set you up a little clinic. And then since you all the women, you have a farm, you raise chicken, you do craft work, you do your vegetable garden, you can sell those and then use that money to pay for a nurse to come in once a week to check on all the pregnant women, and they still get their care. So that even after I'm gone, that impact is still continuing. That work is still continuing. So that's how the new way for us to think about it when we're doing work. And that's what the British ambassador recognized me for that work. As I said, I think the current data indicates that over 2.5 million women have access, and it's now in 5 countries, that same model. So it actually closes a gap without waiting for the government to come build a hospital or having this staffing, which workforce shortage, which we don't have. So you've done something small, but it's sustainable. It can continue.
I love that. I had the thought, sustainable change is smart change.
That's a good definitely.
It is. So I want to go one last one. I want you to tell me what was behind this award. I just think this is amazing. The Lillian Wald Humanitarian Award. So what was behind that?
Yeah, that is, well, for this same work, I think as I said earlier, that year, 2 different years. For this same work that I did in this maternal health thing, I got that one from the National League of Nurses. And then in 2019, this one was in 2015 from the National League of Nurses. Then in 2019, The American Public Health Association also recognized that work that I did and gave me their own version of that same award. But Lillian Wald is the nurse who founded public health in the US. You know, a lady who was so much, public health she's credited with developing the discipline for public health. So those two organizations have developed an award in her honor. And I'm so glad that I think I'm either the first male, if not the first male to have received that award from two separate associations for this maternal health, the work that I did. Because now that little project that we started, as I said, has now been replicated in 5 other countries, 5, not just one. So it carried a whole lot of weight, you know, and it's something that the impact would continue as the program grows. So it's the same, it is for the same work that I done, but again, by another association that recognized the impact of that work.
Well, Dr. Nguh, I applaud you for the work that you're doing, not only here in the US and at your university, but around the world. That's amazing. You strike me, sir, as a rock star in the health profession.
Thank you. My pleasure.
So is there anything else you care to share with us that we have not touched on today?
You know, I don't know. I'm trying to think. I don't know. I just think that one thing, as you know, we talked about this. I love why I decided to go into global health or public health, specifically in Sub-Saharan Africa. For one, that's where I'm from, within that area. But just because there's so much lack and need, there's so much that can be done. And things that are simple, you don't need a whole bunch of money. But because of all that great need, it also provides a ton of opportunities for you to come in and impact work. You know, if you're going to build a house, you start from the foundation. Things like hand hygiene, hand washing, just teaching simple stuff that we do here in the US day to day. It's normal. We take it for granted. You know, in these many sections of the world, they don't have access to those resources or personnel, or they don't even have that knowledge. So I just love the fact that there's so much, while the challenges are many, it just gives you so many opportunities to come in and begin to build and develop. You might just go, I've gone several times where I'm just teaching a class on how to wash hands, hand washing, personal hygiene. You know, you're teaching class about taking your blood pressure, or why, keeping your ideal weight is important so that you prevent kidney disease. Little simple things, you know, think about indoor or outdoor air quality, where when you collect your rubbish or your trash, do not leave it inside the home, or don't keep standing water outside. That breeds mosquitoes. Then next thing you know, you are sick. So it just gives me a ton of opportunities to come in, begin to teach, begin to make an impact. So, and global health or public health, there is so much need where it is a growing field, right? That we're never going to have enough workforce to address also. That's another reason why we need more people to come on board. And I just love it because you can be as effective as you want to be.
That's fantastic. Well, you're doing good work, and we applaud you for all that you do. Okay. Well, you've been listening to the Possibility Action Network podcast with our guest today, Dr. Jonas Nguh. My name is Stephen Middleton. Until next time, good day.